Speaker is Shannon King for Coterie and its cooperative work on health. Do you need any assistance?
Press over. All
You
right.
can introduce your...
Wonderful. Good evening, everybody.
Good evening.
My name is Shannon King, and I am the Development Director at the Coterie Theater.
I'm Elise Beekman. I'm an emergency nurse at the University of Kansas Hospital.
So the
and
Coterie...
a member of the program.
In the program, which you'll hear more about. The Coterie is a theater for young audiences. We serve 90,000 a year through our main stage performances and then also our education programs. Our mission is to open up lines of communication across race, genders, and generations, and we do that through our main stage performances and those other programs. And we are here to talk to you today about one of those programs, the Dramatic Health Education Project.
So HIV and sexually transmitted diseases have lasting effects on the quality of health and life in our community. Young people are just at a greater risk for contracting STDs because they're just hesitant to talk openly, and honestly about their sex lives, and they have a difficult time managing all the misinformation out there about sex.
Would you move the mic over while you're speaking?
Sorry.
Yeah. Here, we'll just hold in.
Okay, sex. So STDs like HIV, herpes, chlamydia, they're really common among young people. And of the 20 million new cases each year, over half of them nationally are reported among young people ages 15 to 24. And then if you look at that in Kansas and Missouri, 20% are reported among youth ages 10 to 19.
So the Dramatic Health Education Project is a unique HIV and STD prevention program provided by professional actors from the Coterie Theater and medical profession students from UMKC School of Medicine and nursing students from KU. And they're trained as peer educators. The program is an innovative and informative way to bring the HIV and STD prevention message to teenagers, aged 13 to 18, grades 8 through 12. We reach them through public schools, through private schools, through charter schools, social service agencies, community centers, juvenile detention centers, and it's all offered free of charge. We do, this year we'll have over 200 presentations serving 7,000 teenagers in the greater Kansas City metro area. So if you request it, we come out and do it. And I put a map up there just so you could see the scope of where we reach. We have a lot of schools in the urban core and then all the way out to Leavenworth, Kansas.
Okay, so what actually happens at these presentations? 2 young adults, one an actor, one from medicine. We present stories through monologues based on the lives of HIV-infected youth in Kansas City. We portray these lives in details, including how they become infected and the different ways that they, discover their positive status. The monologues carry information about, myths about HIV and STDs, as well as transmission and also prevention. Then after the 2 monologues, we disclose that we're actually only taking on the roles of these HIV-infected teens, and this is just a complete surprise to the audience because they have no knowledge of the nature of this presentation.
So then the teams highlight key information about prevention and transmission, and then we kind of move into what is the most vital part of this program, which is the Q&A piece. So following those monologues, we have a question and an answer, and this is the time where the teams really act as peer educators, and they answer the really candid and really real questions of teens. So we constantly update this Q&A yearly just to reflect the changing face of HIV and STDs as it changes in the country and in the city. Funding from Impact KC would support the delivery of the Dramatic Health Education Project to 7,000 teenagers in Kansas City, as well as the comprehensive training that our peer educators undergo, all 40 of them, to become STD peer educators.
So before going into the public, we do undergo a 2-day intensive training, and then there's 2 weeks of individual and team rehearsals. We learn all the Q&A protocols, all the medical content that we have to cover during each presentation. But the best part is that there's no agenda. We cover a balanced message, and we talk about protection and abstinence equally. We serve a diverse population of teenagers across Kansas City, and the effectiveness of the program requires that the teens see us and the storylines as relatable to their own backgrounds. So because of this, we're made up of acting, of medicine, different genders, different races. So like when I go out to present, I'm always paired with a Latino or African American male actor. And then the students are able to identify with us, and when they can do that, they feel more comfortable asking open, honest questions during the Q&A.
So we have three main outcomes we're working towards with this program. One is to improve knowledge around HIV and STDs. The second is to reduce the intentions of teenagers to practice high-risk behaviors. And then the third is to deliver current, culturally relevant, and believable content. Progress towards these outcomes we assess every year through an evaluation administered by our co-directors from the UMKC School of Medicine, Dr. Socken and Dr. Banderas. What's really unique about both the structure and the impact of this program is it's a true partnership, and it's a cross-pollination, which you don't get to see often, between the arts and health sciences. It has long-lasting impacts both on our presenters, which you'll hear about in a little bit, and also just the greater community. We depend on this being a full partnership with the co-directors from UMKC of Medicine because they help us deliver that content really accurately. They co-lead this program not only because they care about health education, but because they've seen how it helps their students professionally develop as well. The partnership is unique because we are able to rely on and learn from the strengths of each other. What we as a theater lack in credibility when it comes to HIV prevention and teaching is offset by our medical partners. And what they lack in a perceived inability to relate and deliver programs to high-risk teenage populations, we offset with nearly 40 years of work with young audiences. So sometimes we get the question of, why now? With Google, you can kind of type in any question you want and get an answer, and those answers are at your fingertips. And so we sometimes get that question, why is this needed right now? And so we sometimes share a list of the questions that kids ask during the Q&A, and people are often surprised and blown away by the level of misinformation that a lot of these teenagers are trying to navigate.
Okay, so we wanted to just show you a handful of some of the questions that were asked during the Q&A, and these are just from the last 3 weeks. There we go.
So could you use a balloon instead of a condom?
What if we're gonna have sex and I don't know if they have an STD? Isn't that awkward to ask?
What do you say to a guy who won't use a condom?
Can you get pregnant from anal sex? And just for context, I was asked that last week.
What if two people who've never had sex before have unprotected sex? Can they still get an STD?
After someone gets HIV or AIDS, do they turn gay?
Can you get HIV from kissing?
Okay, so clearly the teens are hungry for this straight shooting information, and it's just through these tough questions that makes me want to get up at 6 in the morning and drive 30 plus minutes to go to these schools. Like I said, I've been with this program through nursing school, and then I've continued with it through 6 years of nursing just because to me it's so important and so impactful. I shock my friends and family with many of my work stories, but something that amazes them is that every single day I see someone in the emergency department because they think they maybe have or maybe have been exposed to a sexually transmitted disease. And this program has influenced my attitude towards those kind of people, towards sex, and it's even helped me communicate with my patients and just talk with them better. But I think the saddest and probably scariest thing is that I've seen and treated teenagers in the emergency department for STDs, and then I've gone to do this presentation a month later and seen them sitting there in the audience. And I just wish that I could be there in more schools and be there sooner.
So through strong education and conversation, we hope to increase knowledge around these STDs and reduce the intention of teenagers to practice these high-risk behaviors that lead to their spread and transmission across Kansas City. So thank you for your time. Do you have any questions? Yeah?
Nothing as difficult as those. But
Yeah, right?
you've asked us for $15,000. You said it supports the program. In what way? What does that $15,000 go to?
Absolutely. So it's part of a greater budget for this is about $88,000, and that goes towards paying our peer educators through all that training. She talked about that intensive training we have our co-directors are there for, their rehearsals, both the one-on-one and the group practices, and then paying them to go out into the field and deliver this so it's free of charge to schools. Other questions? It's a fun topic.
Anyone else? Thank you very much.